The news day continues here on One News Now. I'm Riza Diaz. Some reports show that the new mutation of Delta could be more transmissible than the standard variant. Now, should this be a cause of concern for us here in the Philippines? Let's find out with Faith Del Mundo. She's going to give us details live from Quezon City. Faith, good afternoon. What does the Department of Health have to say about this new Delta subtype?
Yes, Risa, though there are no reported cases yet of the new sublineage of the Delta variant here in the country, the health department says it is now closely monitoring the situation and is eyeing the implementation of stricter border control. This subtype of Delta variant is found to have contributed to the recent rise in the COVID-19 infections in the UK. In today's Laging Handa briefing, Yusek Maria Rosario Berheri explains that although the virus came from the family of Delta variant, it is not yet classified as a variant of concern or interest. According to the WHO, they are looking at the possibility of placing the UK in the red country list due to this emergence of the Delta subtype. Berere said experts are still studying the effects of the Delta subtype, how it is transmitted, and whether vaccines can effectively fight it. She notes that there is a recent study showing that the subtype is 10% more transmissible, but the evidence remains inconclusive. Health experts are also studying the potential impact of the Delta sublineage of the transmissibility and severity of COVID-19. Berheri advised the public not to panic and to continue to adhere to minimum health standards despite the easing of restrictions. NCR, which is under alert level 3, is currently under moderate risk classification with a 2-week growth rate of negative 52% and 9.87 attack rate. Hospital utilization is now at low risk with 39% bed utilization and 48% ICU utilization rate. Berera said if the numbers will continue to improve, there is a possibility that NCR will see a downgrade to alert level 2 by next month. Risa, despite the improving COVID-19 situation, Berheri reminds the public that mass gatherings are still not allowed even this during holiday season. She says huge gatherings like Halloween or Christmas parties are prohibited and only households are allowed to hold this under a bubble setup and of course with strict observance of health protocols. Riza?
Thank you for that update. That's Faith Del Mundo reporting live from Quezon City. Now, Presidential Advisor for Entrepreneurship, Joey Concepcion, is urging the Labor Department to make vaccination mandatory for economic frontliners. Concepcion is proposing to require vaccination for workers interacting directly with customers like in hospitality, tourism, restaurants, retail, and personal care services, as well as those in labor-intensive work. Concepcion said if fully vaccinated customers are required in these businesses, the workers should be protected as well. In response, Labor Secretary Silvestre Bello III said they will study the proposal. The United States is set to allow the mix and match of COVID-19 booster shots. Now, some experts believe that is a positive step. Let's watch this.
I'm here with Dr. Nadine Burke-Harris. She is the Surgeon General of California, which means she advises Governor Gavin Newsom, and she serves as the state's leading spokesperson on public health issues. So I want to get your quick take on the mixing and matching of COVID vaccines and booster shots in particular here.
Well, I think that when we look at the data and it shows some increased immunity with some of that mixing and matching, I think it will be a positive step and also increased flexibility for a lot of people.
Something else that I find really intriguing here when we talk about vaccines is that people who are hesitant of getting the vaccine to begin with are kind of counting on not getting COVID. They think whatever personal measures they take will be sufficient. And if they do get sick, they know that they can rely on the monoclonal antibodies, which are fairly effective in treating COVID.
Well, I think relying on monoclonal antibodies is not a public health strategy. Each dose of monoclonal antibodies costs thousands of dollars as compared to vaccines, which are much, 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 much less expensive. And in addition, you know, it's what we say in public health, an ounce of prevention is worth a pound of cure. It's much better to decrease the risk of even getting COVID to begin with than take the risk of getting it and hope that the monoclonal antibody will be the solution for you. They have shown some strong effectiveness, but vaccines are still the better way to go.
I want to tie COVID to one of your key priorities, which is childhood trauma. You've done a lot of research on how repeated stress that's experienced in a young child's early years can result in longer-term mental and physical health problems and perhaps even a shorter lifespan overall. How do you see the stress impact brought on by COVID, which is, you could argue, a form of childhood trauma, impacting kids 20 years down the road, 30 years down the road?
I think it's a profound stressor. What we've seen with the COVID pandemic is it's not only increased stress and adversity for many, many people, but it has also limited our access to the healing social connections that a lot of us need to be able to biologically buffer that stress. And so we see increased risk not only for children who are growing up now during the pandemic, but for anyone who has experienced adverse childhood experiences. They may be more vulnerable to the stressors of the pandemic and have increased risk for stress-related disease, mental health, behavioral health conditions. So we see the COVID pandemic being not only a public health emergency from an infectious disease standpoint, but also from a stress-related disease context.
Fantastic stuff. Thank you so much. Dr. Nadine Burke-Harris joining us. She is California's Surgeon General. Thanks for watching. For more videos like this, you can stream Bloomberg Quick Take for free 24/7 in any of the places below. Get live news coverage, interviews, deep dives, shows, and documentaries on the stories you care about most. And be sure to follow us or subscribe to us on Twitter, YouTube, Instagram, and Facebook.
Now, in other news, President Duterte says he is taking full responsibility for the government's war on drugs in order to protect his former top cop. Marian Enriquez has the story.
Huwag kang mag-alala. If there is any person who is going to prison, it would be me. Si Bato na nervyos kasi kasali siya doon sa tukhang niya.
As was his wont, President Rodrigo Duterte once again stood by his man. He says former PNP chief Senator Bato de la Rosa is wary over the International Criminal Court's probe on the country's war on drugs. The two are among the architects of the anti-narcotics campaign.
I assume full responsibility. Sabi ko kay Bato, ako, turo mo ako, si Duterte ang nag-utos.
According to the ICC, they may issue arrest warrants if there is enough evidence, even for heads of state.
When the state has ratified the Rome Statute, that means the state has accepted that even heads of states or any other officials from that state are not immune from prosecution before the ICC.
Duterte also debunked criticisms that the drug war has never snagged a big fish. He cited the 4 Chinese nationals recently killed in an anti-drug operation in Angeles, Pampanga, where 38 kilos of shabu were seized, worth 262 million pesos. But was this really a big catch?
Unang-una, hindi natin ma-verify yan because we rely on a lot on the information coming from the police. Nakita naman natin dun sa profile ng mga napatay, no? Sa karamihan ng mga napatay, puro mga pipitsugi, mga drug dealers at drug users naman yung mga yan.
Human Rights Watch also said that the 52 cases investigated by the Justice Department is not enough, considering that thousands have perished.
So ang tingin namin dito ay mukhang token na step lang ito ng DOJ. Demonstrate sa international community, sa ICC, na kumbaga ay gumagana naman yung hustisya sa bansa.
The Justice Department, in an interview with the chiefs, said that they will be looking into 6,000 other drug war cases. For News 5, Marian Enriquez, we are One News.
Davao City Mayor Sara Duterte meets with presidential aspirant Bongbong Marcos in Cebu. On Facebook, Sara confirmed that they both went to the birthday celebration of Congresswoman Yeda Romualdez. Yeda is the wife of House Majority Leader Martin Romualdez. The Davao City Mayor, however, did not elaborate on what she was able to discuss with Marcos. COMELEC conducts a voting simulation in San Juan City in preparation for the 2022 national elections. Over 4,000 individuals are expected to participate in today's activity at San Juan Elementary School. This aims to address the possible gaps in voting, especially during the COVID-19 pandemic. Health protocols will be in place, such as thermal scanning and disinfection upon entry. Now, if a voter manifests symptoms, he will be allowed to vote in an isolated polling place and will be assisted to the local health office afterwards. COMELEC expects an average of 30 to 40 minutes for the whole voting process. Other simulation activities will also be held in smaller schools next month. Now, here's a quick look at today's other top stories.
Department says it has even begun.
The Departments of Energy and Finance are eyeing to suspend excise tax on fuel prices. This if the rate reach a certain amount. Energy Assistant Secretary Gerardo Erquiza says his agency is now in talks with the DOLE. The country sees a decline in the cases of African swine fever, with only 5 provinces reporting infections. Agriculture Secretary William Dar says only 20 of the 624 cities and municipalities have active cases. And the Manila Bay Coordinating Office is considering to expand the Dolomite Beach. Executive Director Jacob Mimban Jr. says they are looking to give public access to 12,000 square meters or 1.2 hectares of the man-made beach. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now, www.signalplay.com, and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.